All right. Our group focused on deadly medication errors. There were potential ways that we could further further prevent them. Um, we found that medication errors lead to harm in a lot of adult patients. And according to a study that we found, around 250,000 deaths a year can be blamed on medication errors. So our question was focused on how effective are the steps that we have in place now to prevent to prevent medication errors, and are there other steps that we could potentially take?
So Virginia Henderson's nursing needs theory was used to guide our review. Her theory emphasizes the importance of restoring patients' independence and focuses on basic human needs that will enable the patient to progress through hospitalization to discharge. So a nurse can help meet these needs by always following related protocol and looking for ways to make medication administration safer. This review examined prevalence of medication error, current practice of medication administration, and ways to improve medication administration safety. Let's see, our databases included Google Scholar, eBSCO host. The searches were narrowed by selecting within the past 5 years and peer-reviewed searches to increase relevance and to help answer our proposed question. So as far as our results go, it showed that medication errors are prevalent. They'll continue to increase as our population rises. And a big factor is communication errors. And also more needs to be done to help prevent them. Another search showed that there is a correlation between the number of reported errors and corrective measures taken after the incident. Another search showed preventing errors required multiple recommendations, including planning, selection, and procurement, storage, patient administration, ordering, transcribing, and reviewing, preparing, dispensing, administrating, monitoring, patient discharge, and evaluation. Let's see, and another search showed that the most important factors that can be effective on medication errors in nurses include fatigue due to high workload, the large number of critically ill patients, and doctors also have damaged and unreadable orders, and there's also a low nurse-patient ratio.
Some implications that we focused on surrounded the nurse herself, because we determined that it's the nurse's job to keep their patients safe, and nurses are the main ones giving the medications. We covered the prevalence of medication errors in adults in the hospital setting. And we felt like it was important to know that understanding the prevalence of medication errors helps a nurse understand the severity of the errors and why continued research of more potential safety measures is important. It's the responsibility of nurses everywhere to prevent medication and report medication errors, and to keep knowledgeable, to keep knowledge of current best practices for medication administration. For example, one study showed that the use of medication dispensing machines actually helped catch and keep track of medication errors. So just having that basic knowledge of what can be done and what to not do in order to prevent a medication error, as they claim approximately 250,000 lives a year. Some conclusions that we focused on, of course, Virginia Henderson's theory of needs. We focused on the 14 basic needs of the patient. The basic needs of the patient in the hospital settings are often met using medications when those needs cannot be completed alone. The research of the literature concluded that medication errors are prevalent and they will continue to increase, as Kaitlyn said, and more needs to be done to prevent them. Some of the most common strategies we found to reduce medication errors include obtaining accurate weights in kilograms, double checking medication before administration, and the use of a Pyxis dispensing system. The conclusion of this review found that implementation of old and new safeguards for med administration can lead to a decrease in the medication errors and injury, therefore preventing further instances and more severe patient outcomes from happening, such as death.